Hello, good afternoon, and welcome to Optimum Derby Live. My name is Martin Crowson. I'm joined as ever by the MD of Optimum, Tom Heeley. Tom, how are you?
Good, thank you, mate. Good trip away.
Good. Yeah, good trip away. Fine. Just tell us a little bit about that before we get into today's skiing-focused injuries video.
It was with Derby County's under 14 and under 13s to Portugal. We had a tournament there for the weekend.
It was good. Nice weather.
Average.
Okay.
Yeah, not as good as I was kind of hoping for, but
good.
It was a good trip all around. Boys did well. Good tournament.
Okay, great stuff. Back to the colder climes of this country, and we're going to today focus on even colder weather at skiing, and it's the second in our series of 5 skiing videos we're doing to help you better prepare for the slopes this winter and to sort of put yourself in the best position to avoid some of those injuries that can bring a very abrupt end to a skiing trip. Today we're focusing on an area that any skier will want to be looking after, and that is the knees, knee injuries, and we're going to focus on how to avoid them whilst on the slope. So let's get going, Tom. Why are the knees so much under threat from people that go skiing and snowboarding?
I think there's a couple of factors, really. Like one factor, definitely, Martin, is the fact that you've got a big boot on. So the boot plays a big part in obviously limiting your ankle movement. So you're pretty stiff through your ankles, and then the next real transmission of force comes up through to the knees. And technique-wise, there's a lot of technique around sort of dipping the knees in and allowing the hips to sort of transfer across. And then you'll see some angles where the knees kind of come inside the hips or inside the feet.
Why are you talking, Tom? We've got that picture about that with the boat. Should we bring that up now?
Yeah, pull that one in. Yeah, with that one there. Yeah, so you've got this sort of position in B called valgus position, where you typically sort of have the foot in one angle and the knee will drift inside the foot. And again, it's quite common to see that position in sort of the third position with the sort of rotational arrow, where the knee will then start to twist in. And again, another thing, Martin, like you've got your boots on, but you've also got a great big ski on the front of your boot, and that's just going to extend the lever. So if you get the tip of you can imagine if you get the tip of the ski caught on a piece of snow or what you think is soft snow and it's maybe not, and it will just flick the front of the ski outwards, which then causes some of those movements to occur where you start to drift the knee inside and just risks increased risk.
And we've got people watching us today, Tom, on both LinkedIn and YouTube, and everyone's very welcome. For those people that haven't been before, the boot completely locks your foot and your shin right up to your knee, doesn't it?
Yeah,
that's what we're dealing with. So the one top right there gives a good example of that.
That's exactly it. Yeah, so the boot won't come off. The boot connects to the ski, and the ski will pop off. So as long as you've got the settings right on your skis, the level of ski that you are, then those skis should pop off away from your boot when you end up in positions sort of like B and C. Sometimes even in position D as well, bottom right corner. But because you are locked into those boots, you have almost very little absorption through the ankle, and therefore the knee takes a lot of the force, whereas it's naturally sort of running or most other sports, football, rugby, a lot of other things, you take the force through the ankle and the foot, and then that transfers up through the knee and the hip. Almost the first point of call here is the knee, because there is no ability to absorb through the ankle as such.
And I think for people that haven't been, no real idea just the amount of pressure that goes through that knee for skiers of whatever level, and you get in some amazing positions. And we've got this picture, which I'll just bring up now, of guys, they're basically sitting down on the snow sideways, and look at his hand, the guy with the blue jacket on, his hand holding the ski pole, and he's basically touching the floor. And that just illustrates some of the pressure those knees are under as the holding factors in this whole body position.
Completely. And if you were to look at his left knee, so as we look at it, his right knee, and the one that's almost furthest away from the snow, you can see the position of his left foot and then the left knee. And that left knee, you can almost see there, is starting to drift inwards already. And then the hip above that as well. So you're starting to create some angles that you wouldn't normally get into in most other sports. So it's quite important to kind of get into the gym and do the right things to allow these things to happen, because this is part of the technique of skiing, but also to be able to absorb those forces and not just kind of fold under the pressure, really, and the joints to fail. To build the strength around that area.
Before we get specifically into building that strength and doing some gym work and some preparation work, what sort of injuries do people pick up? We know there's immense strain on those knees. What can happen to them?
So there's often, often the big one you hear about is ACL injuries. So they're the big ones really, in two ways. One, because they're long in terms of time frame, so the time frame to recover is a long time.
Yeah.
But also the amount of effort and work that has to go in afterwards to recover is really high. You've got other things as well. So you can have fractures. So you might see somebody land or lose control and maybe get a fracture through the top of their tibia, so the top of the shin bone, I suppose. And then you can also get other ligament injuries as well, to the ligaments on the either side of the knee, typically sort of the inside of the knee where that ligament, the MCL ligament, will get stretched. You do get some muscle injuries, but less so. And that's just more so because the way that the joint is and the way that the boot plays a role as well is that it's more of a ligamentous damage than it is a muscular injury. It's very, very rare for you to get overstretched. It can happen, but it's just less likely. It's more ligament stuff.
Okay. Appropriate to bring up this at the minute whilst we're talking about injuries. We've just focused on the knee, but this goes to show there's a whole other host of dangers that are lurking for you on the slopes.
Yeah, absolutely. So arms as well, the risk of falling. So shoulders, upper arm, collarbones, those sorts of things are quite common. Shoulder dislocations as well are quite common.
Yeah.
And then you've got some lower leg and ankle injuries, which are also up there as well. The boot doesn't limit your injuries, so you can also, instead of that twisting motion happening, instead of that aggravating the knee, that could aggravate the foot. If you can keep that position fixed and maybe the ski doesn't come off, it can aggravate the foot and the ankle rather than the knee itself.
Yeah, I've been skiing a few times, had 2 knee operations, went skiing after both knee operations and came back thinking, do I really want to go through that again? So how difficult is it for these injuries to, end a person's interest in skiing completely?
Yeah, I think I was talking to somebody about this the other day in the clinic, and we were sort of saying that the surgery post-injury, if it's necessary, is almost 50% of the work, and that's the shortest time. So it's maybe 50% of what needs to be done, but it might only take 2 or 3 hours to do that. The next months, weeks, however long, depending on what the injury is, also is 50% of the work, but it takes months, relatively speaking. And I think that's where some people kind of lose a little bit of track as to what that is, and a frustrating and kind of hard to word this, but the surgeon sometimes will say, "Oh, you'll be great in 3 months' time," but don't mention that 3 months needs to be filled with lots of exercises and work and rehab stuff, and
dedication to want to get back.
Yeah, commitment to get it done, because like I said, that 50% of the work is done by the surgeon, but the rest of the 50% needs to be done by yourself, really, to kind of work on those things and get it stronger. Yeah.
And that proves me as a case in point, because I, had my operations, took a couple of ibuprofen and expected to be fine again for skiing. It's not quite as easy as that, is it? Let's move on to what I should have been doing after my operations to get my muscles back. And for those people that haven't had operations at all or any sort of surgery, what can we all be doing to make sure our legs are in the strongest position possible to avoid any major injuries?
I think if we almost think quite simply around the knee itself, you've got kind of 3 or 4 big areas that support the knee. So you've got your hamstrings, which attach to the back of the knee from your hip. You've got your quadriceps on the front, which run from the hip almost to the kneecap and then over the kneecap. And then you've got your glutes, which obviously affect the hip, but also attach to the femur, so they affect the knee as well. And then you've got your adductor muscles, so the muscles on the inside of your thigh and your groin area. So you've kind of got 4. You could classify your calf in there as well. So you've got 5 muscles. The big thing is trying to do movements that simulate skiing, but also that cross multiple joints at the same time. So rather than just doing isolated calf work or isolated hamstring or quadriceps, so instead of sitting on a leg extension machine and just doing leg extensions, yes, that has a part to play, but there's a lot of other exercises and movements that you could do to get a lot stronger that also impact the quadriceps and the calf and the hamstrings all in the same action, which is what's going to happen on the slopes. So when you're skiing, you can't just tell your calf to contract now, or you can't just ask your quadriceps just to work now. It doesn't work like that. They have all these muscles work in what's the word, in symmetry to support a joint or multiple joints. So we need to do some exercises which are crossing multiple joints, and that's quite difficult to kind of think about. So squats, simple. Lunges, really good. You got to think about the position you're going to be in your boots as well. So a lot of the time it's kind of front facing, so you're on to your toes a little bit more, and almost leaning into the boot. So you've got to think of doing some drills which are a little bit more front foot focused. So that might be almost doing some squats on your toes, or doing what we call like an RDL, almost with your weight forward onto your toes.
Because when you're in those boots, Tom, you can literally lean. You can literally lean right the way forward, can't you?
Yeah.
With flat feet standing there, they hold you in position so much on the slopes.
Yeah,
on the skis,
heel, as long as you've got the right size and right settings, your heel shouldn't really lift too much, and you don't really want to be sitting too much onto your heel and pulling through your toes, and that causes something which we call backseat skiing. So you sit quite far back into your boots, and also you're almost sat down rather than leaning. It seems counterintuitive to lean into the mountain, so to lean down the hill rather than lean back into the hill. So you almost need to attack it and almost get to the front of the boot. So a lot of the exercises we try to do especially with the GB team, is get forwards. So getting onto the toes and spending time sort of through the front of the foot. And that can involve all sorts of funny little drills, as well as your typical big lifts like your deadlifts, your squats, your lunges, your step ups, those sorts of things.
Yeah, okay. Strength is one thing, but balance and agility, I imagine, is something else as well. So can you give anybody ideas, anybody tips, to improve those aspects of it as well?
Yeah, 100%. So a little bit like returning to running, or a little bit like returning to most sort of multi-directional sports, there's an element of like agility and an element of balance and control as well. So when we follow like a bit of a program and a protocol, we try to plan to work on getting some strength through just the individual muscles to begin with, and then trying to get some strength through the joint. So multiple muscles working across that joint. And then once you can do that, we'll then start to look at doing some rebound work. So that might be things on a trampoline, might be things in a pool. It might be things on rebounds on a softer surface. So crash mats or a little mini trampette's great, really good. The pool's really good as well because it takes a lot of the force. And you reduce the impact of the body weight kind of hitting into that area. And then we go on to things like jumping forward and landing. So it might be on two legs, and then we'll do a hop. So hop forward and landing. And then it might be very similar. Instead of going forwards, we'll go side to side. And that could just be individual hops, and then it could be continuous hops where we start to build up that tolerance to repeating those movements, similar to what you would do transferring your weight when you're skiing from one foot to the other foot.
And that's such an important part of learning to ski properly, isn't it? That transferal of weight wherever you are on the slopes.
Yeah, 100%. And being able to maybe something as well that's not realized, the slopes aren't just smooth, so they're not like a road or like a velodrome, for example, where it's just a smooth surface, a flat surface. There's bumps in there, these moguls, these bits of snow that are just maybe not quite soft. Maybe they're firm and they've flicked up from something. So being able to do those sorts of exercise and those sorts of movements on some unstable surfaces as well is also great. So using something like a Bosu ball, the trampette's another great example of that.
Yeah.
But using surfaces that are unstable as well to challenge that control and quickly get those muscles to fire to stabilize the joints.
Yeah. I can recommend that Bosu ball just as an amateur skier as well. It's really, really good for trying to make sure you strengthen the right areas and your balance is there.
100%, great bit of kit, and not. You can get a second-hand one for maybe 50 quid. Yeah, they're about 100 quid brand new, but great piece of kit. You can do loads on them. Great piece of kit.
Okay. To finish with, let's not get into the techniques of how to ski properly because we're here for a long while then. But let's get into the ideas about how to fall over properly. We all do it, some more than others. So have you got any ideas when somebody knows they're going down, what things to protect and look out for? Because it can be quite hairy depending on the pace you go in.
Yeah, absolutely. I think probably even before that, I would have a look at making sure, especially if you're hiring skis, and you're hiring boots, make sure that the settings on your boots are the right settings. So it's something called DIN settings. So when you get your boots, the guy will probably ask you your weight, and he'll probably ask you your level of skiing. And based off that, he'll use a screwdriver to set the torque almost on the boot to the binding, so the boot to the ski connection. Now, if that's really, really high, the ski's not going to come off. So if you're a beginner skier and you get caught out, what will happen first is that the ski will just flick off, which again just reduces your risk of injury. But if you're a bit more
and that's what that setting is done for you. We have to trust these people who we're hiring off to get the settings right based on your weight and your ability.
Absolutely, absolutely that. And again, you can even take them back to the shop. So if you're not quite happy on the first day and it's not come off, or it's come off too easily, then for the level of skier that you're trying to do, then you can always take them back and just say, can you increase this or top this up a little bit? So that's the first thing I'll do. The second thing then is if you know you're going down, is to try and see your landing. It's probably one thing I would say, is trying to spot where you're gonna fall. And often it's something a bit like judo or karate, where they try to like use the back of their hand and almost like roll. So if you can spot where you're going down, you can see the snow that you're going to hit. It almost goes into a bit of slow motion, weirdly. Try and almost fold and roll rather than just trying to like put your hands straight out.
It's a hard technique to learn, because that's how we all just instinctively put our hands down.
100%. Just try and put your hands out and protect. Even if you tuck up and just go arms sort of like tucked in, rather than have sort of like flailing arms, you've got to think you've got poles as well. So poles are in the way. You might even have a bag on and you've got skis and stuff all over the place. Don't worry about all your stuff. You can go and get that later, but always better to just tuck and roll rather than trying to like stop and trying to grab something or try and like claw onto something. And almost just to kind of hope and anticipate that your skis just pop off, because it makes it a heck of a lot easier to kind of get sorted then.
Interesting. Really, really interesting.
It sounds like no one's going to want to go skiing now after this discussion, but it's great. It is great fun.
No one is going skiing without falling over at least once, Tom. It's skiers of your ability.
Oh yeah, no, everyone falls over at least once. All the time.
Apart from your work with the British snowboard team, have you got any chance to get any skiing in yourself this winter, or is it just all work?
No, I think maybe after Christmas there'll be a couple of trips with the ski team. I think that's probably going to be to North America and the States.
Wow.
But nothing before then. And certainly no like personal trips, no holidays this coming winter. Okay. We've got other things on the horizon, which is kind of
got other things on the horizon. Oh, Tom, that's been really interesting. We're just about running out of time, so we'll wrap it up there. But as usual, if anyone is interested in building up a strength and fitness and agility regime before they go skiing, or they pick up any injuries after they've been skiing, call you guys at the Optimum Derby Clinic and you can sort them out.
100%. Yeah, just give us a call or drop an email, and we can chat things through as to what you need to do or what level you're at on. All sorts of stuff.
Great. If you'd like to find out more about Optimum Derby, the website address is at the bottom of the page. If you'd like to get in contact with Tom directly, as he said, drop him an email for anything specific there. He's always there to help. If you're watching us on LinkedIn today, thanks for joining us. If you're on YouTube and you've enjoyed it, please subscribe to the channel. We've got 3 more skiing special broadcasts coming up over the next 3 weeks. There's various stuff to check out on that YouTube channel, all sorts of injuries to be wary of and ways to get fit and stay fit. We did one about a horrific ACL injury a while ago. There's details on how to get right after an Achilles tendon tear. And then last week we started off our skiing special with Tom talking about his life working with the GB Snowsport team, specifically the Moguls team, and where that's taken to him and all the fun and enjoyment and learnings he's had from that. That leaves me, Martin Crowson, to say thanks a lot again for joining us today. Tom, thank you once again for your time. We'll catch up with you next week.
Perfect. Good to speak. It was good fun.
And thank you so much for joining us here today on Optimum Derby Live. We'll hopefully catch up with you next week for next in our skiing injuries series. Until then, take care and enjoy the rest of your day. Bye-bye.